Okay, good afternoon, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. Today, our speakers are again joining the briefing virtually to adhere to social distancing guidelines. And we begin the briefing today with some opening remarks from Mayor Kenny. Mayor, you have the floor.
Thanks, Mike, and good afternoon to everyone. I know many of you have questions about the city's response to today's storm. The city's Emergency Operations Center was activated at 8 a.m., and the team is closely monitoring the approach of the storm. We're pleased to be joined today by Fire Commissioner Adam Teal, who wears a second hat as the city's Director of Emergency Management. He'll be available for your questions in a few minutes. I also want to talk about the ongoing issues related to trash and recycling collection. Every day, our sanitation workers are on the front lines serving our communities during this pandemic. We're all adjusting and responding to unprecedented change. Yesterday, the Streets Department resumed a normal trash collection schedule. Residents can now place trash curbside on their regular collection day. Recycling continues to be delayed significantly. We want to thank residents for their patience, support, and cooperation during these unprecedented times. As you know, the department is hiring new temporary workers to ease what we expect will be a temporary problem. So we have expanded operating hours of the sanitation convenience centers to 7 days a week. But there still may be delays as the department continues to balance increased tonnage and staff shortages. The COVID-19 pandemic has prompted many residents to spend much more time at home, generating an excessive amount of trash. Industry reports note residential trash increases by more than 25% nationally, and that includes here in Philadelphia. Excessive trash tonnage has caused delays across the city with curbside collection service. We want to ask every resident to help out by taking part in our Curb Your Waste campaign. The campaign promotes 10 tips on how residents can help curb their waste, which helps with reducing delays and supports our employees. Among them are these tips. Set out your trash properly. Make sure all trash is placed in sturdy trash bags. Cover containers with lids. Reduce your food waste by using garbage disposals. Consider composting or freeze food waste until your collection day to eliminate odors and pests. Check the weight of the trash bags. Each bag should not exceed 40 pounds. Overweight trash bags can cause injury to sanitation workers, break open and cause litter conditions, and cause garbage collection delays. Hold off on do-it-yourself projects that can increase curbside tonnage. Reduce excessive construction debris, wood, or furniture that exceeds set-out limits. Limit bulk waste to 2 items per household only. No white metals, electronic waste such as computers or televisions. No hazardous materials. Please help protect our sanitation workers. Drop off trash, recycling, yard waste, electronics, and other materials at sanitation convenience centers located throughout the city. Sanitation convenience centers are now open 7 days a week from 6 a.m. to 8 p.m. You can find locations and all the other ways to curb your waste at philadelphiastreets.com. That's philadelphiastreets.com. These and other tips can go a long way in protecting the health and safety of our workers, improving Streets Department collection service, and reducing litter. And remember to thank our sanitation workers for their hard work and service they provide during these challenging times. A thank you goes a long way to show your support and appreciation. It's a hard job and hard conditions, dealing with lots of stuff that we wouldn't want to deal with on a regular basis. Again, residents can visit philadelphiastreets.com for more details. And now Dr. Farley for his update.
Thanks very much. Good afternoon. A week ago, the coronavirus case rates in Philadelphia were rising, and we expected them to continue. But instead, since then, they fell. And I don't know if that's a long-term trend or something temporary, but any decrease is good news. So here are the numbers. Since this time yesterday, we've identified 106 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 30,771 since the beginning of the epidemic. Now, for the past week that ended Saturday, July 29th, we averaged 123 cases per day. That's down from 166 cases per day the week before, and 141 cases per day the week before that. Now, our new cases that we got today are still predominantly younger people. 35% were under the age of 30, and 52% were under the age of 40. We also track the percent of people who are tested that test positive. And for the last week that ended last Saturday, we averaged at 4.7% that were positive. And that's the lowest weekly percent positivity yet that we've seen yet. We've been between 5% and 6% since the middle of June. So that's another good sign. Since this time last week, we've identified 3 new deaths from the coronavirus infection, bringing us to a total of 1,695 since the beginning of the epidemic, of which 860 or 51% were in nursing home residents. Now, in the past week, we're averaging about 7 deaths per week, or about 1 per day. To put that in perspective, at the peak of the epidemic in mid-April, we were averaging nearly 250 cases per week. We're down about 97% as far as the number of deaths we're receiving per week. In our nursing homes now, we're getting about 2 cases per day citywide. That's a very low number. We want to have it be 0 if we could. We're watching that very closely. And in the city's jail, a few positives that came up in the past week or so. We had 1 inmate who went to the hospital for a different reason, not related to COVID, and was screened there, was tested positive. In the wake of that, the jail screened 64 other inmates in the unit, of which 4 others tested positive. None of those 4 others had symptoms, or other ones are still fine. As far as our testing citywide, we are seeing improvements in the turnaround time for 1 major laboratory that is supplying testing for the city. That's the Lab Corporation. They were having a turnaround time average around 7 days. Now they're around about 2 days, much better. Still, we're having long delays for another big laboratory, Quest, and some delays that are too long for some other smaller laboratories. A little update on where we are with contact tracing. We're making progress since what I reported last week. So for the period from Sunday of last week through Friday of last week, which we haven't quite closed out, but we're close to it, we attempted to reach 611 cases for whom we had phone numbers. Of those, we were able to complete the interview on 64%. That's up from 55% the week earlier. We had 3% who refused. That's down from 6% the week earlier. And we have not reached yet 32%. That's down from 38% the week earlier. Of those cases that we interviewed, about a third reported no contacts, either that they didn't have them or they couldn't name them. And of those who reported contacts, they averaged 2.8 contacts per case. And of those contacts, we've now reached and interviewed 70%. So that's what's happening in Philadelphia. Now, outside the city, it's important. Across the Philadelphia region, we are seeing case counts falling in the surrounding counties in the last few days. As with the city, it's too early to say if this is a trend, but that's certainly a good sign. And in the U.S. as a whole, the epidemic appears to be declining now. Daily cases are now falling in the U.S. as a whole, as well as many southern and western states. So in summary, case counts are now falling here in the city of Philadelphia, in the region, and in the U.S. as a whole. Now, they're not falling by much, and this could be temporary, and the case counts are still high. Still, though, the news is better than we were a week ago. And the reason for that fall is really unclear at this point. I can only say that maybe people are finally coming around to accept the idea that they need to wear masks. And mask use has gotten high enough that it's really making a difference. I hope that's the case. Now, let me talk about mask use for a minute. If the case counts fall, I want to remind everybody that's not the time to put away the masks. We need the masks now more than ever. If there's one thing you can do to help fight this epidemic, it's commit to wearing a mask whenever you're around others. It's especially important as we approach the reopening of colleges and universities and some schools in the city. When you wear a mask, it's a sign of respect for the people around you. You don't want to pass the infection on to them if you have it and you don't know it. Now, we do track mask use in Philadelphia. We have a graph on our website. That's based upon observations we're doing on people in indoor SEPTA stations and exiting retail stores. When we completed the data from last week, overall, it was 71% of people observed were wearing a mask. There's an overall increasing trend. But we want to get up to 90%. We have a goal of 90%. So most people are doing the right thing, but we need to get more to use masks regularly. Finally, let me just remind people about the risks to vulnerable populations. Even though we have a slight decrease in case counts, there's far more virus circulating in Philadelphia than is safe. Remind you, if you're over the age of 65 or if you have chronic medical conditions, you are at risk. Stay at home and avoid contact, even with relatives and caregivers who might themselves be out and about because they may be exposed and you don't want to get the virus from them. So if you're staying at home, your relatives and your caregivers who are with you should be wearing a mask, and you should be wearing a mask when you're around them. More information is on our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. And now we turn over to Armando for the Spanish language translations of the mayor's and Dr. Farley's remarks.
Palabras del alcalde Jim Kenney para el martes 4 de agosto del 2020. Buenas tardes. Sé que muchos de ustedes tienen preguntas sobre la respuesta de la ciudad a la tormenta Isaías del día de hoy. El Centro de Operaciones de Emergencia de la ciudad se activó a las 8 de la mañana de ayer y el equipo está monitoreando de cerca la tormenta. Nos complace que hoy nos acompañe el comisionado de bomberos, Adam Thiel, quien cumple otra función como director de manejo de emergencias de la ciudad. Él estará disponible para sus preguntas en unos minutos. Quiero hablar sobre los problemas actuales relacionados con el reciclaje y la recolección de la basura. Cada día nuestros trabajadores de saneamiento están en primera línea al servicio de nuestra comunidad durante esta pandemia. Todos nos estamos ajustando y respondiendo a cambios sin precedentes. Ayer, el Departamento de Calles reanudó el horario normal de recolección de la basura. Los residentes ahora pueden colocar la basura en su acera el día regular de su recolección. Sin embargo, el reciclaje continúa retrasado significativamente. Queremos agradecerles a los residentes por su paciencia, su apoyo y su cooperación durante estos tiempos sin precedentes. Como saben, el departamento está contratando nuevos trabajadores temporales para aliviar lo que esperamos sea un problema temporal. Hemos ampliado el horario de atención de los centros de conveniencia de saneamiento a 7 días por semana. Pero aún puede haber demoras a medida que el departamento continúa equilibrando el aumento de tonelaje y la escasez de personal. La pandemia de la COVID-19 ha llevado a muchos residentes a pasar mucho más tiempo en casa, generando una cantidad excesiva de basura. Los informes señalan que la basura residencial ha aumentado en más del 25% a nivel nacional. La cantidad excesiva de basura ha causado demoras del servicio de recolección de basura en toda la ciudad. Queremos pedirles ayuda a todos los residentes participando en nuestra campaña Reduzca sus desechos. La campaña incluye 10 consejos sobre cómo los residentes pueden ayudar a frenar sus desechos, lo cual ayuda a reducir las demoras en el servicio y apoya a nuestros empleados. Entre estos están los siguientes consejos. Deseche la basura correctamente. Asegúrese de que toda la basura se coloque en bolsas de basura resistentes y cubra los recipientes con tapas. Reduzca el desperdicio de alimentos mediante el uso de trituradores de basura y considere el compostaje o congele el desperdicio de alimentos hasta el día de la recolección para evitar malos olores y plagas. Verifique el peso de las bolsas de basura. Cada bolsa no debe exceder las 40 libras. Las bolsas de basura con sobrepeso pueden causar lesiones a los trabajadores de saneamiento, abrirse y causar retrasos en la recolección de la basura. Evalúe usted muy bien los proyectos de manualidades. Hágalo usted mismo, que realice en su hogar, ya que pueden aumentar el tonelaje en la acera. Reduzca el exceso de escombros de construcción, madera o muebles que excedan los límites establecidos. Limite el desperdicio de grandes artefactos a 2 artículos por hogar solamente y que no excluyan, por favor, metales y desechos electrónicos como computadoras o televisores que tengan materiales peligrosos. Ayude a proteger a nuestros trabajadores de saneamiento. Deposite la basura, el reciclaje, los desechos del jardín, los electrónicos y otros materiales en los centros de conveniencia de saneamiento ubicados en toda la ciudad. Estos centros de conveniencia de saneamiento ahora están abiertos los 7 días de la semana, desde las 6 de la mañana a las 8 de la noche. Puede encontrar sus ubicaciones y otras formas de frenar sus desechos en philadelphiastreets.com. Estos y otros consejos pueden ser de gran ayuda para proteger la salud y la seguridad de nuestros trabajadores y mejorar el servicio de recolección del Departamento de Calles y así reducir la cantidad de la basura. Y recuerde agradecerles a nuestros trabajadores de saneamiento por su arduo trabajo y su servicio que nos brindan durante estos momentos difíciles. Y esta es la actualización en materia de salud para el día martes 4 de agosto del 2020. Esta semana esperábamos que los nuevos casos aumentaran, pero en lugar de eso, y felizmente, están disminuyendo. Esto es una buena señal, pero aún es muy pronto como para decir si esta será la nueva tendencia. El día de hoy reportamos 106 nuevos casos con un total de 30.771 casos acumulados. En promedio, hemos tenido 123 casos diarios durante la última semana que acabó el 29 de julio. Esto evidencia una reducción de 166 casos diarios durante la semana anterior. Ha habido un descenso en los casos entre las personas más jóvenes, entre los cuales reportábamos las tasas más altas de contagio. A pesar de ello, los casos nuevos son entre las personas predominantemente jóvenes. El 35% de los casos se han reportado en los menores de 30 años y el 52% de los nuevos casos entre los menores de 40 años. El promedio de casos positivos es de 4,7% de todas las pruebas. Y hoy, lamentablemente, reportamos 3 fallecimientos por el COVID-19 en la ciudad. El total acumulado de muertes por la COVID-19 es 1.695. 860 de estas muertes se registraron en hogares de ancianos y representan un total del 51% de las muertes. En el pico de la epidemia reportábamos 250 casos en hogares de ancianos diariamente, pero actualmente reportamos 2 casos diarios en promedio y lo estamos monitoreando cuidadosamente. Respecto a las pruebas, hemos visto mejoras en los tiempos de respuesta de uno de los laboratorios grandes, LabCorp. De 7 días ha pasado a dar respuestas en 2 días, pero seguimos viendo retrasos con los otros laboratorios. En cuanto al rastreo de contagios, hemos realizado un buen progreso. Hemos identificado 611 casos con números de teléfono. 64% completaron la entrevista, del 55% anteriormente. El 3% rechazó la entrevista, y esto bajó del 6% anteriormente. Y el 32% de los casos no pudieron ser contactados aún. De aquellos que fueron entrevistados, un tercio reportó no haber tenido contacto con otras personas o no pudieron identificarlos. De aquellos que reportaron contactos, el promedio es 2,8 personas. Igualmente, de esos contactos, hemos sido capaces de localizar el 70% de ellos y luego los hemos entrevistado. En la región, los casos continúan disminuyendo, pero es aún muy pronto como para decir si esta será la nueva tendencia. En cuanto a la evolución de la pandemia en los Estados Unidos, vemos que ha llegado a un punto de estabilización e incluso pudiera estar en declive. Esto puede ser algo temporal, ya que el recuento de los casos sigue siendo alto, pero las noticias son más alentadoras. No sabemos la razón de la disminución de los casos, pero probablemente sea por el uso adecuado de las máscaras. En cuanto al uso de las mascarillas, aun si el recuento de los casos disminuye, este no es el momento de guardar las mascarillas. Esto es necesario ahora más que nunca. Si sales de casa, por favor, usa tu mascarilla. Esto es especialmente importante para el reinicio de colegios y universidades. Tu máscara muestra el respeto por las personas que te rodean. Pueden observar un gráfico sobre el uso de las máscaras en nuestro sitio web respecto a las tiendas minoristas y en las estaciones de SEPTA en sus interiores. La tendencia es creciente. La semana pasada se llegó al 71%, pero nuestra meta es un cumplimiento al 90%. Un recordatorio. Hay un riesgo muy grande aún para las poblaciones vulnerables. El virus aún se encuentra circulando en Filadelfia. Si usted es mayor de 65 años o tiene condiciones médicas crónicas, usted está en riesgo. Por favor, quédese en casa. Evite el contacto con familiares o cuidadores que están fuera de su casa. Tanto usted como ellos deben usar una mascarilla cuando estén cerca. Todos juntos podemos ganar esta batalla, así que usa tu máscara. Gracias.
Thank you, Armando. And now we're going to move to the Q&A portion for members of the media. We're joined today by Managing Director Brian Abernathy, and as the mayor mentioned earlier, also joined by Fire Commissioner Adam Teal, who serves as Director of the Office of Emergency Management. We're going to start off with questions related to either the COVID-19 pandemic or questions about the storm that arrived in the region this morning. So for the first round, again, questions only on those two topics. If your hand is raised now on another topic, please lower it and we'll try to get to it later. As usual, we have limited time, so one representative per media outlet is permitted to ask the questions, and we ask that you limit your questions to 3 or fewer. We will do a second round of questions if time permits. Let's start off now first with Denise Clay of the Philadelphia Sun. Denise, can you unmute?
Yes. Good morning. Good afternoon, everyone. My first question is for Dr. Farley. You mentioned the last there have been delays in getting test results back, despite the fact that now one of the labs seems to have gone from a 7-day wait to a 2-day wait. Has there been particularly the ones that have hospital labs possible using those facilities to process coronavirus tests so that maybe it can take some of the pressure off of the bigger labs and have results more quickly for folks here?
Yeah, the connection wasn't good. I think I understood your question is, can we get redirect the testing to hospital laboratories so we get a quicker turnaround? We are trying to redirect testing to laboratories that have a quicker turnaround. I can tell you the hospital labs are telling us now that they do not have the capacity to do additional tests because they're having difficulty getting the reagents, that is to say the chemicals that they use to run these tests. So there's a limit there, but we are trying to redirect to some non-hospital laboratories that are in the local area that can do the test more quickly. It's a more complicated process than you might think, but we hope to do that so that even if we can't solve the problem today, over the longer term, we're not so dependent on these national labs that can have have bottlenecks and long turnarounds.
Okay, thank you. My next question
Denise,
has
I
to
just,
do
Denise.
with what impact, if any, yes.
Denise, I'm sorry, your connection
Yes.
is quite poor. If you could log out and log back in, and we'll get back to you because we.
All right. Thank you.
Thank you, and let's move now to Martin Pratt of Philly YBN.
Yes, this is a question probably for the mayor or Bryant. Is there a plan, or if there's not a plan, has there been discussion about slowing down the free food distribution?
Slowing it down?
In other words, cutting back on locations, cutting back on times.
I'm for the storm or for going forward?
For going forward, sorry.
I'm not aware of any reductions. I don't know, Brian, you know.
There's been some conversations. This has always been a very major and significant operation. And so there has been some conversations about modifying that operation in order to better staff it going forward, especially as both the district and the city move back to normal operations. We don't have any specific announcement right now around food distribution, but certainly as those develop, we'll get back to you.
Thank you. I appreciate that, Brian.
Yep.
This question is for Dr. Farley. Dr. Farley, Dr. Fauci, I think it was Monday, talked about the aerosolization of the virus now and recognizing that the virus, one, we should probably be wearing goggles, but two, that it's definitely not a good idea being in small spaces. With what we're talking about for pre-K, is there any guidance you're planning on giving pre-K sites or centers to open a certain way to deal with what's in the air, not so much the hands and the face and mask, but is there an air filtration that they need to be aware of or thought around that?
Yeah, thanks for the question. So we still think that the predominant mode for transmission is to people in direct contact with each other through large droplets. However, there has been this question for a while now about the degree to which these small aerosols that they could float in the air might be able to spread the infection from one person to another. And then that gets to the question of how important ventilation is to reducing the risk of spread. We haven't talked about that much in the past, and in view of the, at least the concern out there and the possibility that that is one mode, even if not the predominant mode of transmission, we're probably going to be making some recommendations soon that just clarify what steps to take to improve the ventilation to lower that risk. I don't think that those steps are going to be impossible for people running buildings, whether it's a daycare center or others, to follow. But we want to give some clarity for people of what they can do to reduce that at least a theoretical risk or possibly a real risk.
Martin, you all set? All right. Let's go back now to Denise Clay. Let's see if your connection's better. Denise, are you there?
Yes, I am. Is that better?
Give it a go. Let's hear.
Okay. The University of Kentucky, and I'm directing this to Dr. Farley, the University of Kentucky is currently in the process of testing 30,000 of its college students in preparation for them to go back to school this fall as a means of having a baseline for possible transmission at the particular university. Has there been any talk about doing that with any of the local colleges here in Philadelphia? Because in 2 weeks, Temple opens and some of the other schools open, and you have parents who are concerned about whether or not their kids are going to be able to do an entire year in their dorm, or if they're going to have to come back home and go to online learning because there's been an outbreak.
Right. So we have been consulting with all of the colleges and universities in Philadelphia about their safety plans. In that, we have not recommended that they require screening of everybody to come back on campus. That may sound like a good idea, that, okay, then you start out with nobody infected and then you'll never have an infection. The problem is the virus moves very quickly, and the campus is, people in the campus interact with people in the community very readily. And so even if everyone's negative today, tomorrow a number of people may be positive. So more important than baseline testing is really being vigilant about masking and following all the other safety precautions to prevent the spread from one to another. That's what we focused on, and we do think, based on our conversations with the colleges and universities in Philadelphia, that that their plans are strong. Not to say that there won't be a spread on campus, there probably will be, but we think that they can minimize that.
Okay, thank you.
All right, thank you, Denise. Let's go now to Laura McChrystal of the Inquirer.
Hi. First, I have a question for Dr. Farley.
You ready to go?
You mentioned that cases are decreasing, but you're not sure where the long-term trend is heading. I just want to clarify, would you actually call this a decreasing cases rather than a potential plateauing of cases?
I would say it's a decrease. The average last week was, I forget the number, I said 123. That's compared to 166 the week before and 140 something the week before that. So that is a very real decrease. I don't know if that's going to be a continued decrease or if we'll see it rise again this following week.
Okay. And I also have a couple of questions related to trash and recycling collection, or for, I guess, either the mayor or Brian. With the ongoing delays, I'm curious, why the city is continuing with every week recycling at this point, rather than trying to go back to every other week in order to keep up, rather than have people leaving their recycling out and going sometimes a couple of weeks without it being collected.
Well, and Brian can add to this if he likes. We've been trying different things. We need to keep up with the bulk trash, not the non-recycling trash, because of the heat and because of the conditions that creates when it's not picked up. Every other week recycling also causes problems because it's so much, it slows the crews down. The biggest problem has been getting enough crews on the street. A lot of that has to do with the 100 or so people that have experienced some problems relative to the ongoing virus. People who have been working 7 days a week, 12 hours a day, and are exhausted. And that's why we're bringing on 120 or so new temporary employees to catch up with how we've gotten behind. We are up to date today. We're back on schedule on regular trash. They've asked for a couple of days of don't put your recycling out so we can make sure we stay on that. People, and again, as I said in my remarks, we need public's help in putting out their trash in a manner that allows the sanitation workers to pick it up effectively, and not get hurt because of the heavy weight that they're having to pick up off some of these sidewalks and alleyways. So I mean, we're in a pandemic. We have people that are sick. We have people that are exhausted, and we're hiring more people, and this will work itself out. We've had 3 storms in the interim. So everything together has created these problems that we're working our way through.
Okay. And one last question. You mentioned that the problem with trash pickup is a short-term problem. I'm wondering, how long do you intend tend to have the temporary employees stay on, given that, with some companies planning to have people working from home into next year, it kind of becomes a longer term thing?
Well, these people were all on a waiting list to be hired anyway. These weren't just people that were hired off the street. These are people who went through a process and were waiting to become laborers for the city in varying roles. It just so happens that we have a need in sanitation at the moment. So this is not, I don't think it will affect people not coming to work in an office building. We have a trash problem primarily because everybody's home and we're creating 25% more trash. So if you take 25% more trash, reduce the amount of people picking it up, you're going to have delays. And we're trying to make the two, the amount of trash being generated and the number of people picking it up to level out so we get back on track on a regular basis.
Yeah, and Laura, just to answer your question, the temporary workers are hired for 6 months.
Okay. If I could just quickly clarify that question, I guess, do you hope that in 6 months the problem will be kind of alleviated and that people won't be home all the time producing more trash by that point? Or
we hope to be on a regular caught up basis much sooner than 6 months.
Yeah, and remember that there's two sides to this challenge, right? There's the amount of collection, so the amount of trash that people are putting out, which may last as long as 6 months or when people go back to the office, but it's also about having staff in place to be able to collect the trash. When we have more than 100 folks calling out on a daily basis, it's hard to make sure that we have enough crews out. 120 workers will fill those crews, and hopefully over the next 6 months, we don't see that vacancy problem continue. And if we do, we'll certainly adjust in 6 months as well. This is not we work through a solution, and if we need new solutions or that solution doesn't work, we're going to try something else and make sure it does. So, it continues to be a fluid situation. We're not going to say that, this is the final end all and be all for trash collection.
okay,
Right.
thanks.
Thank you, Laura. Let's go now to Kristen Johansson of KYW.
Hi there. I don't know if this is for Dr. Farley, the mayor, or Brian, but now that, restaurant workers live off of tips, and now with the extra $600 in the federal stimulus money ending, is there any thought maybe to pushing back the 10 p.m. curfew for restaurants so that some of those workers would be able to maybe make more tips during the time so that they can sustain life and live?
Doctor?
We haven't thought about that. We can talk about it and see if it makes sense.
Was there a reason? I just don't know. Is there a reason for the 10 o'clock, or in general, was there like a study that was showing that 10 o'clock for some reason would make a difference?
I don't believe that's a limit that the health department put on this. I'd have to understand more about the rules, but Brian may know. Yeah.
So, and Kristen, if you remember that, all the restaurants are serving outdoors, and in many of these corridors, they have people who are living on those corridors. And so we are trying to balance the needs of residents with the needs of the businesses and the workers. But I think your point is well taken, and certainly one that we'll explore and see if we can address.
Okay, thanks. That was it.
All right. Thank you, Christian. Let's go to Natasha Brown of CBS 3.
I'm just on the call here. Hi, hello. Can you guys hear me?
You bet. Go ahead, Natasha.
Okay, sorry. This is for Commissioner Teal, just in reference to our storm earlier today and kind of wreaking havoc around the region. Just wanted to get some idea here locally what we were dealing with in Philadelphia and what you guys were seeing, during the height of the storm and what you were dealing with.
Thanks, Natasha. Appreciate the question. I want to make sure everybody understands the storm is not over. The bulk of the rain has ended. However, we're still going to have significant wind gusts for the next few hours, and the flooding has really just begun. In fact, we just got an update. We expect the Schuylkill River will actually rise to near 18 feet tonight. Flood stage is at 11 feet. So we're really spinning up now to deploy a lot of additional resources. We've already had resources out there. We have multiple water rescues in progress across the entire city. We've sent mutual aid resources to Delaware County. We're in touch with FEMA. So this is actually, probably while the rain has ended, the worst of this event is yet to come. And I really want to remind people, turn around, don't drown. If you can't see the road, do not drive through the flooded roads. We've had submerged vehicles. We're rescuing people from houses right now along Darby Creek. Hobbs Creek is completely flooded. The Wissahickon is out of its banks. And again, just right now, the Weather Service updated their forecast about the Schuylkill. So you're going to see a lot more activity. We've already done 180 fire-related incidents this morning, and that's about 5 times what we normally do by that time in a day. So very busy. We'll continue to be busy. We need everybody's help to not get into situations where we have to put folks in harm's way and make rescues. So we have a lot of things going on right now, and you'll see a lot more from us going forward with this new update from the Weather Service.
Natasha, can you unmute again? Sorry.
Okay, yeah, that's all I had, actually. Thank you guys very much.
Thank you. Let's go to Kennedy Rose of the Philadelphia Business Journal.
Hi, my question is for Dr. Farley. I was wondering, with the case counts decreasing and percent positive rate decreasing, does that make you optimistic for the possibility of having indoor dining in September or Eagles fans in the stadium in the fall, or is it too soon to tell?
Since a week ago I called this wrong, I'm going to be careful not to call the future at this point. It's really hard to say where the virus is going to go. I'm certainly pleased to see the numbers go down, but I can't say whether they're going to continue to go down. And I certainly can't say where we'll be on September 1st.
Okay, thanks so much. That's all I had.
Thank you, Kennedy. And Nina Feldman of WHYY, you are up.
Hello. Just one question, a clarifying question. Is it for especially in the instances where the lab results are taking a little bit longer to come back, is it the official recommendation of the health department for people to isolate while waiting for their test results or not?
If you have symptoms, yes, you should isolate while waiting for test results.
But if you don't, if you just believe maybe you were exposed, you should just monitor for symptoms?
Yes.
Okay, thank you. That's all.
All right, thank you, Nina. We have no further hands raised for questions. I know Commissioner Teal has quite a lot on his plate. Did anyone have any further questions regarding the storm response for Commissioner Teal?
I'm sorry, Mike, can I go back and just amend that answer I gave to Nina? Just to clarify, if somebody's in quarantine because they had a known exposure, then they need to stay away from people and not go out while they're waiting for the test results.
Okay, thank you. Thanks for clarifying. Martin Pratt of Philly YBN. Did you have anything for Commissioner Teal?
No, I didn't. It's for Dr. Farley.
Commissioner, you're relieved. Thank you for your help. If you need to get back to your duties,
Thank you.
Okay.
Thank you, Commissioner, for your service.
And Martin, you're up.
Yes, Dr. Farley, the statement you just made, if there's a couple and one of them is quarantine, self-quarantine, the person that's not self-quarantine in that same apartment do you recommend they go out? Do you recommend, how does that work when there are people that work in direct contact with each other and one definitely tested positive?
Well, if someone's in quarantine, if at all possible, we want them to stay away from their household members too. So stay in separate part of the house, separate room, separate bathroom. If they are constantly in contact with that other person needs to be careful. I would recommend they not be going out and around and exposing other folks.
Okay, thank you very much. That was it.
Thank you, Martin. Thank you, Dr. Farley. Seeing no further questions, we will bring the briefing to a close. We will resume on Thursday at 1 p.m. Thank you.